and I wish everyone a warm welcome to our virtual fireside. My name is Tilman Rüppel. I work at MedMissio, and I am a board member of Action Against AIDS Germany. And today's topic centers around the role of the Global Fund in saving lives worldwide, focusing on its programs, the upcoming aid replenishment, and the challenges global health actors face in times of budget cuts and geopolitical disruption. As you probably all know, since its founding, the Global Fund has placed saving lives at the core of its mission. It regularly publishes data on the impact of its interventions in over 100 countries. And according to its recently published results report, the Global Fund's investments were responsible for saving 70 million lives over the past 2 decades. 70 million people, that is more than the entire population of France or the United Kingdom, to let that sink in. Therefore, this achievement demonstrates impressively that donor contributions are very well invested. Now the aid replenishment seeks $18 billion to save an additional 23 million lives. However, with many donors cutting development budgets, prioritization has suddenly become key. Programs must reduce costs while still sustaining impact. Global health actors such as the Global Fund, UNAIDS, WHO, and many more are all facing this highly problematic pressure. And at the same time, questions arise over what truly counts as life-saving. Because to fight HIV, tuberculosis, and malaria, diagnostics, medicines, and prevention tools are essential. But without community-based initiatives, these tools often fail to reach the people most in need. This raises the critical issue of access for key populations because many face marginalization or persecution. Without their engagement, life-saving resources may remain unused or fail to reach all those who need them most. Following from this, many important questions arise. How can the Global Fund maintain impact despite donor cuts? Which strategies are needed to ensure access for vulnerable populations in fragile contexts? And how can global health actors respond when political and structural challenges threaten the most marginalized communities? These are just some of the questions we want to discuss with our distinguished guests today. But first, a short organizational note. Today's discussion will be recorded, and this recording will be published as well. Moreover, this fireside chat will be held in English without any translation provided. Furthermore, please switch off your cameras as well as microphones, and a group screenshot will be taken at the end of our discussion. But now, and without further ado, I want to give the word to my dear colleagues and moderators of today's discussion, Tania Siebenbrot and Peter Wiesner.
Yeah, let me start first. My name is Peter Wiesner. I am the Advocacy and External Relation Officer of Action Against AIDS Germany. I'm a long-term HIV and community advocate. And since I talked already quite some time at the beginning, I hand it over to Tania to introduce herself, Tania, and our speakers. Thanks, Tania.
Yeah. Yes, thanks a lot. Good morning. Can you hear me?
Yes, yes,
excellent.
We can hear you.
Wonderful. So first of all, let me thank you for your invitation to this fireside chat on what is considered life-saving, which is a topic that is very important to me and in the current context. So following the global and financial developments, the Global Fund faces budget cuts earlier this year, and consequently it had to make difficult decisions on priorities, including certain trade-offs. During this process, Germany has strongly advocated that vulnerable and key population groups must have access to health services under all circumstances. This is extremely important to us. And measures to ensuring this access must be regarded, from our perspective, as life-saving. So this also means that preventive measures continue to complement treatment options to make sure that the mix of interventions is suitable for each specific context. A pill on the shelf on a pharmacy only becomes life-saving once it reaches the person in need. To get it there, you need strong and integrated health systems that work hand in hand with community systems to ensure care is accessible to the very last mile. So this is a non-negotiable for me and for us, for Germany, and I will continue to stand for this in my role as board member on the Global Fund. And let me stress on the main priorities. This brings me to the second question concerning your priorities. You might have heard that the federal minister has highlighted the importance of multilateral organizations for German development cooperation in the area of global health. The recent results report on the Global Fund proves this important role. With 70 million lives saved, the Global Fund remains one of the most effective financial mechanisms in the fight against HIV, tuberculosis, and malaria. And having said that, the scarcity of resources is a reality and is unlikely to change for the better in the coming years, which is why a continuous focus on efficiencies and better coordination is necessary. The current funding crisis has also highlighted the urgency of reducing the dependency on donor funding for health systems in the Global South. It should thus be a priority to support countries in their transition to more self-sufficiency. This concerns not only middle-income countries, but all countries, at least in the long term. And this means that we must focus on domestic resource mobilization and on the integration of interventions in national systems to make them ready to provide life-saving services. Of course, I think I'm aware that this is very difficult for some countries, given the resources and the capacity constraints that exist. We need to find a way to ensure that essential life-saving health services are still available in the poorest and most marginalized settings, including those that are fragile contexts. With diminishing resources, we might need to look at how we prioritize countries and what type of support they will receive. This is something we are also seeing in other global health initiatives like Gavi. Surely, prioritizing should not happen to the disadvantage and risk of population groups who already face the greatest barriers in accessing services. I'm very concerned about the anti-rights and anti-gender movements worldwide and strong support the Global Fund's efforts in this regard. I encourage the Global Fund to use its voice against discriminatory policies and legislation. Protecting human rights and gender equality requires political will. Actually, at the same time, life-saving measures should include support to non-governmental actors that have better access to the communities facing the greatest barriers. And this must be anchored as a key principle for health systems to be equitable and sustainable in the long term. I therefore also place emphasis on measures that help to strengthen the health systems as life-saving. With this, I have to state Germany is committed to the protection of human rights, access for key and vulnerable populations to life-saving health services, and strengthening health systems. These are our political priorities for Global Fund support. And we therefore emphasize the importance of these topics also in ongoing evaluations and audit processes. They are important instruments to gain insights whether measures are implemented, where they are most urgently needed, and reach those most in need. And let me say, to do this, we need to know which measures are efficient and effective, especially with reduced financial resources. Only then can we take the right decisions for the next allocation cycle. And we owe this to those affected because they are the ones who suffer the most if funds are used inefficiently. Thank you for that. I hand over.
Yeah, thank you so much, Tania Rödiger-Vorwerk, for your input from the BMZ perspective, and yeah, for highlighting the priorities and also the focus regarding the budget cut. First of all, I would like to introduce myself because I'm also Tania. I work at DSW, and I'm happy to co-moderate the session today with my colleague Peter Wiesner. And yeah, but it was a very good kickoff. I think we are right now very deep in the middle of the conversation about the Global Fund, about the work of the Global Fund, and yeah, also the situation with the budget cuts, and yeah, also in regarding to the next replenishment. And but now I would also like to so also thanks a lot to the other speakers who are here with us today. That is also once Ganna Dovbakh. She's the executive director of the Eurasian Harm Reduction Association. And then we have also Tess Hewitt with us, the Global Fund focal point and health policy advisor of MSF Belgium. And of course, also thanks a lot to Tania Rödiger-Vorwerk. She's the Deputy Director General of Global Health Resilience Equality of Opportunity at the Federal Ministry for Economic Cooperation and Development. Yeah. And now I would like to invite also Anne-Laure to provide some input from the Global Fund Secretariat. And because since its creation, the Global Fund has tracked the impact by measuring the numbers of the life saved, so a calculation that has shown us always the success stories of the Global Fund. And I have two questions. So first, why does the Global Fund calculate the life served, and what purpose does this calculation serve? And then second, in a time of tighter budgets and growing political skepticism, how relevant is this measure today compared to earlier years? So Anne-Laure, the floor is yours, and you have around like 5 minutes.
Thank you so much, Tania, and thank you for inviting me here today. Indeed, as we mentioned, I mean, HIV, AIDS, TB, and malaria continue to claim lives every day, and with millions of deaths recorded annually. So through the results report, I mean, we showcase the impact that the partnership has achieved through close collaboration with affected communities, government, civil society, the private sector, but also technical partners. And indeed, I mean, previous speakers have mentioned that, but we just published the new results, and they showcase 70 million lives saved since 2002. So quite a big number. And indeed, we would also need to factor in what would have happened without those interventions, right? Because that's the impact achieved. But without those interventions, we also model that HIV deaths would have risen by actually 90%. TB deaths by 134%, and malaria deaths by 94%. So indeed, quite a big impact in terms of avoiding those additional deaths. And I think it's really helpful to remind us of that against the backdrop of a global health funding crisis, but also exacerbated by other issues like rising drug resistance, debt distress, human rights erosion, and climate change. So important to keep that kind of impact in mind. And if you want to take one concrete example, if you look at Zambia, for example, life expectancy increased from just 43 years in 2002 to 58 years in 2021. And more than 2/3 of this gain is due to fewer people dying from HIV, TB, and malaria. So also beyond that life expectancy number, it also means that you have more people able to go to school, more people able to work, and more capacity in the health systems for other issues. So it's critical to acknowledge that kind of impact, and indeed to focus on how to safeguard the progress that has been made, because that cannot be taken for granted. And it also highlights what is at stake should the Global Fund support be withdrawn. So indeed, it goes beyond the life saved number, but also that kind of multiple benefits across societies. And a key factor in sustaining the progress of the Global Fund partnership is to ensure access to key and vulnerable populations. So beyond the moral imperative of allowing everybody to have access to health services, equitable access is also essential for disease control. And so in this grant cycle, 3-year grant cycle, the Global Fund invests 6 billion in key building blocks of the health and community systems to be sure to reach the poorest and the most marginalized. And about 3 billion in grants are being managed by civil society organizations in this grant cycle. So community health workers are central to these systems and to this progress. So they deliver HIV/TB services through integrated care at the community level, but also through counseling and psychosocial support. So the Global Fund also supports engagement of key and vulnerable population into Global Fund grant processes and national processes related to those diseases through specific tailored initiatives. So we have one community engagement initiative that is supported by the German technical assistance via Backup Health, and also through other tailored initiatives like the Breaking Down Barriers, focused specifically on upholding human rights through the grant cycle. So community-led approaches are critical not only for connecting key populations to tailored services, but also to strengthening global health security. And this is something that impacts us all wherever we are, the global health security piece. And the first line of defense is from in front of outbreaks is the rapid detection and timely reporting of those outbreaks. And in many countries supported by the Global Fund, community-based volunteers and health workers have been trained to detect and report unusual health events in real time, forming really the backbone within that event-based surveillance system. And our funding to grassroots and community-led organizations strengthen and encourages locally led responses as one of the cornerstones of our key founding principle that is really the country ownership and that inclusive model. And when you have community-based organizations that lead or are included in implementations, the programs reflect the local needs and context and build the capacities for the longer-term sustainability. So a robust AIDS replenishment, so that will take place in the fall and aims to raise the resources for the next 3 years, would enable the Global Fund partnership to sustain these life-saving efforts, including continued support for community-led organizations, community-led monitoring, and community-based initiatives. And a fully funded AIDS replenishment could result in up to 23 additional million lives saved. So a figure that is really worth highlighting. And as we just discussed, the life saved number is just not a statistic. It means global health progress, but it also means deep socioeconomic benefits. So with that, thank you so much, and back to you, Tania.
Yeah, thank you so much, Anne-Laure, for your input. So I think everyone can see the success of the Global Fund and about the calculations, so that we all know what the Global Fund is doing and what would happen if the Global Fund doesn't work in those fields, and also the great work with the community. Yeah, thank you so much. And I'll hand over to Peter.
Yes. In order to hear more about what is at stake with the cuts and everything, we listen now to two speakers, and we start with you, Ganna. Ganna, you're the executive director of the Eurasian Harm Reduction Association, and we want to hear from you what the recent financial cuts, what they mean for people who use drugs and for their networks and for their communities, in particular in your region, and what the impact of all this is all about. And maybe you start with a definition of life-saving. So what is life-saving for you, or for a sort of drug community perspective? This might be quite interesting. There's one limitation. You have only 6 minutes, and we are going to stop you when it goes beyond because there are other speakers as well. So thanks so much for being with us, Ganna. I'm really happy that you agreed to take part here. Thanks.
Thank you very much. And actually, I wanted to start with this. My mother always saying that medicine is needed for emergency. If really person is dying, then you are calling medical help. Otherwise, you are not approaching medical help at all because that's dangerous or taking money or whatever. This is the approach we had in Eastern Europe and Central Asia and sometimes have in political minds of a lot of politicians still now. So as soon as the person is dying, and you don't need the medical help. And even concept of prevention still is not in the popular mind, unfortunately. And in case of harm reduction and interventions which were supported by Global Fund for all these years, they are really life-saving. In case of the overdose deaths on the street or in the place where people are using drugs, that's the overdose. In this case, harm reduction is life-saving. Opioid agonist treatment is also life-saving because person who is taking off the criminal use and illegal use now spending just 5 minutes or 10 minutes to get the treatment in the morning and then absolutely happy and like as every one of us, not very happy, but at least working life and the family life is back. And that's about the safety in the good meaning of security, the safety of communities, because that's absolutely other life than the criminal life in illegal. The same with the advocacy, which is also could be life-saving if we have the changes in the law, which are not tremendously crashing people's lives. I mean, in criminalization of drugs, drug possession, for example. But saying about the life-saving, we could not stand only for this ambulance or emergency car, which is really saving in this moment. We need to think a bit longer. So our thinking time zone for life-saving need to be really not in this 5 minutes or in this hour, but for the longer period, which should include prevention. But it also should include treatment of the chronic disease. And I'm rather long time working here in this field. And I do remember when, with the support of Global Fund in 2004 in Ukraine, there were first antiretroviral treatment board. And the first harm reduction from 18 small pilot projects, it became broader for the whole, covering all the Ukrainian cities with the basic services, needle syringe programs, opioid agonist treatment program, overdose prevention, connecting with the hepatitis C treatment, connecting with the testing and treating antiretroviral, the HIV. So for me, I saw how with the absence of any services for people who use drugs, for sex workers, for LGBT people, for women in the hard situation, for teenagers who are who are in the vulnerable positions and who could experimenting with drug use or who could be involved in any sex work. For all of these people, Global Fund became a source of funding to have basic entrance to the social and mental and general health services. Usually, because this is the outreach programs, social workers from the peers who are going in the street and finding people who otherwise will not go to the health facilities. And unfortunately, the last couple of years, not couple, from starting of Russian invasion in Ukraine, when not only war started and awful genocidal war started in Ukraine, but it's also point where we see in our region the start of the backlash against the human rights, against the vulnerable groups, and we have a lot of laws which now shrink in civil space, which are now limiting, in a lot of countries, limiting the possibility for civil society to work using international resources, and they are called undesirable, they are called foreign agents, they are really put into ghetto, not having no possibility to speak with the governments and to provide services. So the situation now, unfortunately, even having some hopes. For example, opioid agonist treatment in Georgia, in Kazakhstan, already paid from the governmental sources. In Ukraine, even in the wartime, harm reduction is prioritized in the national strategies. So it means that it's already much more ready to take over the services for vulnerable groups than it was in 2004. But as for now, the pressure of the political pressure on the gender equality, on human rights, on vulnerable groups like LGBT who are called in Russia the terrorists, like the whole LGBT community called the extremists and terrorists, and to people who use drugs. Right now, we are afraid, and we see it, how the cut in the USAID funding and how cut in the other funding, and even the inability of Global Fund to support, for example, the basic behavioral survey to know where we are with the epidemic among vulnerables. Because the Global Fund also facing now already some cuts and liquidity challenges, even with the current grants. We see how all these vulnerable groups who already built their capacity, civil society, where there are thousands of peer counselors who could contribute in the response, how we now face challenges which compared with the 90s when there were nothing. And we could not hope that the governments will step in and will take this responsibility. Not everywhere. Somewhere like Ukraine, Moldova, they could be like this. But even European countries or candidates to Europe, they are not ready politically to step forward. Yeah, that's why we need your support. And I'm very happy to hear from Dr. Tania that Germany is on the side of human rights, and that's really now crucial and needed to have this support. Thank you.
Yeah, thanks so much, Ganna. This was still in time. Thanks so much for your input. And what's going to happen and what we need will basically be the topic of the second round of our discussion. Thanks so much for addressing the access issues for IDUs and the importance of outreach work and the backlash that we experience. Thank you. We go over now to Tess Havitt from MSF. And Tess, we invited you because we thought this topic goes way beyond our experience as people working on HIV, tuberculosis, and malaria. In order to save life, we need, that's what we felt, the experience of the humanitarian sector. That's why we invited you to tell us and to give us some recommendations of what you would recommend to us. And so my first question is, what is currently at stake for the humanitarian sector in terms of the cuts? What are the mechanisms the humanitarian aid sector developed to prioritize within computing priorities in a world and within a media context that shifts its focus from day to day, depending on the new catastrophes that are coming on? What is your definition of life-saving? From your perspective, what do we need to serve life? Again, to you, you have 6 minutes, so we hope to be able to learn a lot from you. And thanks so much for being with us. Over to you, Tess.
Great. Thank you so much, Peter. And I'm really thrilled and honored to be here. Thank you for inviting me. Just to also manage expectations. So 2 things. Yes, so I'm the Global Fund Liaison or focal point for all of MSF. MSF has different operational centers across the world for our operations, but I link up the Global Fund, and that's why I'm here today. I think also 2 things. I sit on one of the delegations for the Global Fund as well, which is unique for MSF to do this. And there's a reason behind that, which I'll go in terms of answering the questions. And my background is actually global public health. So I come from a public health background. So this caveat and link between humanitarian and public health for me is really important. And there's not a clear answer. It's nuanced, and it's important to have the discussion and keep it open. It's not that it's this way or that way, or that humanitarian has the solutions even that you propose, but more that it's collaboration, and it has to be a conversation that continues and develops, and it will never be completed or concluded, I think. Just in terms of what are the pressures at the moment currently at stake for humanitarian sector, no surprises, funding, competing priorities. I think that the gap left by the funding cuts at the moment are really taking a lot of strain in terms of humanitarian. We obviously respond to big crisis and emergencies, Gaza, Sudan, Haiti, but also protracted crisis that require long-term investment and flexibility, like South Sudan and DRC. These are investments that take a long time, and they're very heavy and resource intensive and costly as well. We are a short-term fix. We're not a long-term fix in terms of humanitarian, but we've had to stay into certain contexts for a long time because there hasn't been the opportunity to fill the gap, if you like, and the crisis continues. It hasn't been settled and become stable. I think in terms of, for me, what I've seen in terms of the discussions around the Global Fund, and as I say, like the potential cuts that have taken place through the US and other responses in terms of development, I think that when we're looking for these cost-saving mechanisms and solutions, it's really problematic for humanitarian, because I would say with domestic resource mobilization for MSF context, which is 70 countries plus, a lot of those contexts, it's not suitable to be having this conversation here and now, because yes, completely agree that countries should be stepping up. And the long-term goal is for countries to be self-sufficient and have this capacity for their health system to respond to the people in need and their populations. But the reality that we see is that they don't have those mechanisms in place right now. So even when we're talking about the next replenishment, it's not going to be happening in terms of these countries stepping up. It's going to take longer than the next 5-10 years. In some contexts, it really isn't on the horizon at the moment. So to talk about this is actually putting the onus on the people and the patients, who will then have to be paying for the cost of their health needs, and they don't have those costs. They don't have that capacity. So in terms of savings, that I see a lot of, and I understand why completely, because of the pressures on donor countries, etc. But the savings to be made for humanitarian, it doesn't make sense. And how to get that message across is quite tricky. And also in terms, as I say, we are costly. We are seeing an increase in terms of demands of conflict and emergencies, and we cost a lot. So we won't be able to step in and step into the gaps that we see in cuts. We are having to respond. I mean, in terms of the way that we've worked and moving on to like learnings, I guess, or how we've responded, we've tried to, and this is something that everybody already does. I don't feel this is unique to humanitarian, but we're not an island. We can't just work by ourselves. We definitely need to work with the system, and that's what we've done in a lot of areas. But now, because of the cuts, it means that we're also hit. So, for example, in terms of cuts of commodities like Sudan and DRC, Nigeria, South Sudan, Honduras, we're having to look at our system and say, okay, we were used to receiving these commodities from X, where may it be the Global Fund or others, because we were trying to work with the system. Now we're having to look at our stocks and whether or not we can fill the gap. And to reiterate, we can't and we shouldn't, because we're the short-term quick fix solution. We're not the long-term. But in the immediate needs for the population and people that we see, we're having to consider how to do that. And humanitarian works on like very short cycles. We work on a cycle of, we're just looking now for our operations for the next year. We don't go beyond years. So we're very quick fix. It means that we're very agile. It means that we're very adaptable. It means that, you know, we look at our buffer stock for the next year. We look at our staffing for the next year. But beyond that, we're not looking at it, because that's not, we need to keep that flexibility. We need to keep that ability to move around resources, but it is reliant and with the assumption that there will be development and long-term solutions in place. And that's where the cuts are taking place, as you know, and it's having a knock-on effect for us. I think the principles of humanitarian around humanity, neutrality, impartiality, and independence are also crucial for us. And I think that emphasis on, we're talking about the people in need. So for humanitarian, it's not about the Ministry of Health as such. We're looking at the people in need. That is our focus. That's where we are trying to provide a service for the people in need, wherever they come from, whatever their affiliation and so forth. And I think that the emphasis, and why am I as MSF, as humanitarian, and it's unique, working with the Global Fund or engaging with the Global Fund, it's because the Global Fund have this capacity, unlike other global agencies to the same extent, of working with the people in need, working with keeping that focus on the key populations, keeping the focus on the civil society organizations that we don't see with the same capacity of other health entities. And that's why we work with the Global Fund and why we see it so crucial in terms of the replenishment and unique. And if, as I say, as humanitarian, yes, we will engage with the quick fix, but the long-term solution has to be with the people in need. It has to be that focus, and that's what the Global Fund, I think, does. Just quickly on the life-saving, please go.
Perfect. Okay, a very quick definition of life-saving, but only one sentence, and then we have to head on. Is this possible?
Yeah, of course. I think that the life-saving, as I said, for MSF, it is we're a very quick fix. It's the in-health facility, but really what we've learned is it has to go beyond. If you're really going to address the needs, life savings, and as a public health person, I would say you have to go upstream. You have to look at the causes and you have to consider them. Humanitarian won't respond to them, but definitely it has to be part of the response for life-saving.
Thanks so much, Tess. I'm not going to repeat what you said, but what I really liked that you just made it very clear that there are sort of short fix solution, and there are partners that work for a long time on chronic diseases continuously, and the collaboration between both is important. And there's the Global Fund that would sort of contribute to that. So thanks so much for that. And now, Tania, you've been so quiet the last 10 minutes. So over to you, my co-moderator. Please go ahead.
Yes, I'm happy to introduce now the second round of questions. So because like in the first round, we talked about what is at stake, and we got a lot of great inputs from all the speakers. And but in the second round, we would like to focus on what do we need to be able to save lives. So some of you already touched the base and already started a bit to talk about that. And I would like now to invite Ganna again. I would like to ask you how sorry, I'm a bit sorry, I'm a bit confused. Yeah, I would like to ask you about the what do you really need to be able to save the lives? What are the structures do you need, and what do you need for your work?
Thank you very much for this question. And actually, we asked our community of people who use drugs once if there will be half of the resources available or 20% of resources available. And first they are saying we need opioid agonist treatment. And that's not obviously, it's coming usually like antiretroviral treatment we do need, but what about the harm reduction, opioid agonist treatment? Okay, a lot of thoughts, but for the people, and that's thousands of people in our region, to get treatment for their dependency, it's to save lives and their families from criminalization. And that's response from them. And from me, I would say that we need very, very bad comparison, but it's on the table of politicians right now. One missile, which we definitely need to protect Ukraine, but one missile costs around 2 million euro. And it means all harm reduction services supported to civil society in 4 countries like Lithuania. So you could compare one missile, which will not enough even for one attack in Kiev like it was yesterday. It's 4 annual budgets of harm reduction in the countries like Lithuania or Ireland. And yes, for Ukraine, it's a bit bigger because the number of people who use drugs and key population is bigger, but what we definitely need, it's some basic secure funding for civil society who are ready to work and to provide services for key populations. That's the basic. And one more tiny funding, it's usually not more than 5-7%, it's advocacy support. Because if we are not vocal, if our community are not trained to speak with the politicians or decision makers, we will never come to the position when the state and municipalities are paying for the services by themselves and understanding what role of harm reduction in the landscape or in the mapping of the social and health support on the municipal level, and how when harm reduction is disappearing, what's happening with the social care funds, with the criminalization, and with all the situation in the municipality, with the safety situation. Thank you.
Perfect. Thank you so much. Yeah, the same question I have also for Chess. Would you like to elaborate on that? What do we really need at the moment to save lives?
I think the very straightforward answer is yes, the funding needs to be sustained. I think that if you take it out now, the progress that has been seen will obviously backtrack and so forth, but you know this. I was reflecting, okay, so in terms of humanitarian and MSF and the perspective, and I think what's happening is very humbling in terms of really looking at where the challenges are and how we need to respond. And I think definitely the collaboration, as I said, and the focus, keeping the focus and the determination on the people in need. This is where the focus should be, and what really makes sense for those populations and those people, and not just where is it going to save money. If it's going to save money, or it looks like it might do in the immediate sense, but actually in the long term it won't. I would say this is public health as well. Is that not a bit of a backtrack? Is that not contradictory in terms of the aims? And one last thing that I wanted to say was for MSF and humanitarian and the gaps that I see. I think that data is really crucial here in terms of understanding of the prevalence of what's happening with the key populations, and it's likely to be an immediate cut, I think, if anything. And I do think that the collaboration between humanitarian could be strengthened there as well, in terms of using what we see as humanitarian for the needs of development and understanding where the gaps are that we see. And again, the focus on the actual people in need and the population.
Perfect. Thank you so much for elaborating that it's really the people we need who have to make with us the decisions. And I'll hand over to Peter again.
Yes, thanks so much, Tania. The topic of the second round is, what do we need to save lives. And of course, we as German civil society, we need a strong BMZ, a strong Ministry of Cooperation and Development Aid. So, Tania Vorwerk, the question to you is, how strong is the influence and the voice of the BMZ within the government? And of course, governments itself that they need to prioritize, and with the war going on and all the other problems that we have the feeling that development cooperation is not very high on the agenda. That's our feeling, and I would hope that we are not right, but I think we are right here. So what do you need from us as civil society to better influence decision making at the governmental and the parliamentarian level? And what are for you the most convincing, and especially for internal BMZ discussions, what are the most convincing arguments that really count and that really matters when it comes to very difficult decision making? So the floor is yours, and you have something like 5 to 6 minutes, and then we are going to wrap it up. Thanks so much for being with us.
Yes, thank you so much. And I think it's also a signal that you see two of the German board members in this call. It's Harriet and me. So that shows that we are extremely committed to global health. Nevertheless, there are budget constraints and other challenges we are facing. So looking at the minister who is in charge since beginning of May, you see that the minister is very open to campaign for increased commitment to multilateral initiatives in global health. She stated that from the very beginning. And so far, she has taken up many of the topics we have brought to her attention. And she's available to use her influence to put them on the agenda. The current financial and political environment is without doubt, as you just elaborated, a challenging one, and globally and at home. Germany's continued commitment to invest in the Global Fund is therefore extremely important. So it proves that Germany is a reliable partner in tough times. And however, in times of reduced budgets available to BMZ, difficult decisions have to be made, like you just said, to be made in priority setting and budget allocation. So we have to keep in mind the pressing priority of many causes BMZ is advocating for example, sexual and reproductive health and rights programs that support access to family planning, maternal and newborn care, are facing serious funding shortfalls. And the same applies to other equally important sectors within the global health space. So we thus encourage civil society partners to use the available channels, as you know, at their disposal to influence public opinion. You have other ways to reach out to people, and you reach other people than we typically do from the side of the government. And you speak with a different and important voice. So having said that, moreover, civil society organizations are key in collecting evidence of what is working. And these are extremely valuable insights when it comes to decision-making within the Global Fund. But they can also be used as convincing arguments in political discussion. And in this way, they hopefully inform decision-making at this level too. So whilst there's not much leeway in the current budgetary situation, it is still worth expressing your concerns, share your insights with other ministers and political actors. Visibility for the topics is still important, even if it does not immediately translate into higher budget. And putting the issues onto the public agenda and creating room for constructive debate around them is particularly important. This can help to counter disinformation campaigns that are started with the opposite intention. So we have very convincing arguments. We have data that prove the Global Fund's effectiveness in mobilizing resources for health and getting them to the people who need them the most quickly. At the same time, investing in Global Fund programs contributes to health security and other return on invest for all countries. So it's an important action to put your voice into the international debate and advocate as you have done recently. Thank you.
Yeah, thanks so much. You basically described what we are doing from day to day. And you mentioned the disinformation campaign, which is probably something new, especially with parties that are probably not in the center of democracy. Let's put it like that. Yeah, thanks for highlighting the community voice. This is for us nice to hear, and this is of course a source of collaboration as well as we do, and to both of you, Harriet, as well. Thanks for being with us. We are basically at the end of the discussion. There will be a very roundup, a very brief roundup by Tillman. But before we go that, we have 1 minute for each of you. And the question would be, what is your, in light of the discussion that we had, what is your take away and take home message? You have 1 sentence, not more. I mean, a sentence can be very long, so not more than 1 minute. And we start with Ganna. Ganna, what is your take home message?
In
Please.
current crisis, we definitely need to be united. Everybody who are really in the values of human rights, gender equality, supporting vulnerable people. We need to be united. We have no right to step out or to find some discrepancies. We are together. Thanks.
Thanks so much. Over to Tess, please. What is your take home message for us?
I think it's to keep on having the conversation, keep it open, and make sure that we're really listening to what is the reality of what we're seeing, and that focus on the population, the people, and what makes sense for them, and not purely on where savings are to be made is vital in this.
Thank you, Tess. So we heard the wish to be united. We heard the wish to listen to one another. And now, Dr. Tania Vorwerk, to you, what is your takeaway?
My takeaway is that we have a common goal we are working towards, and we have different levels and modes of activity to work complementary towards it. Over.
Thanks so much. We are perfectly in time. So now, Tillman, you have almost 5 minutes to summarize the discussion, and at the end there will be a photograph of all of us, and Marvin is going to jump in when it's time. So over to you, Tillman.
Okay, thank you, Peter. I expected not to have 5 minutes in total, so maybe I will be a bit shorter, but I do have 5 key takeaways. And the first one is all of the vulnerable and key population groups must have access to all essential tools, and this really constitutes life-saving. However, the current funding cuts are really hurting in this regard. Second, the Global Fund remains essential in the global fight against HIV, tuberculosis, and malaria, saving millions of lives each and every year and fulfilling a crucial role in helping the people in need. This really highlights its importance as well as the urgency for a successful replenishment. Third, civil society organizations also remain highly important, not just in terms of helping people in need, but regarding shaping public opinion too. Fourth, countries and communities that are impacted by HIV, tuberculosis, and malaria should become financially independent, but the capacity to do so is very much lacking in many places as of now and in the foreseeable future. While at the same time, leave no one behind truly must be upheld everywhere and in all contexts. And fifth and finally, life-saving interventions are the first line of defense against infectious diseases, hence crucially contributing to global health security worldwide. And also, for those who would like to revisit the discussion, this session has been recorded and will soon be available on our webpage. Feel free to share it with colleagues or revisit the key moments. Also, I also want to give many thanks to our guests and moderators for this great discussion and everyone behind the scenes who helped prepare and organize. But at the very end of our fireside chat, I kindly want to ask everyone to switch on their cameras because we still want to do a picture of the entire group. And therefore, I am handing over now to my dear colleague and Marvin Meyer, who is going to take the group photo, please. Marvin, over to you.
Thank you. So that's an invitation for everybody who wants to first put on a big smile and secondly, switch on the camera. And I will just do a little screenshot. And for all those who are switching on with that, you agree for an incredible advertisement campaign. Thank you very much. And I'm going to, so this is, oh, there is still more people coming. This is awesome. So this is 3, I tried to smile and do the screenshot. 3, 2, 1, go. Oh, did it work? This was maybe not the best of all smiles for me, but I was so really trying to concentrate on you guys. Give me 1 sec. And this looks like it has worked very well. Thank you very much. And I'm handing over to Peter again.
Yeah, thanks so much for everyone. We have still 2 minutes, but we are not going to consume that. I'm not sure when we have our next fireside chat. Maybe one this year, but we will sort of inform you as soon as we have decided upon that. So thanks so much for being with us. Thanks to everyone who contributed. It was a pleasure. It was fun. As a moderator, you are always a little bit nervous, so I'm going to listen to it later when I'm really relaxed. And yeah, with that words, I think we can go home, do your work, and do good things. Thanks and bye-bye.